Hello, everyone, and welcome to the webinar. My name is Manal Prince, and I'm the Manager of Examinations at the CPO. Today, we will be reviewing how to prepare for the Ontario Clinical Exam, which I will refer to as the OCE throughout this webinar. Further information and resources to help you prepare for the OCE are available on our website at collegept.org in the Preparing for the OCE section. If you have not reviewed the information on the college website outlining the format or the blueprint yet, I would highly encourage you to pause this webinar and take a look at those first. I will be referencing the blueprint and online resources, so be sure to have these documents or links open. So to begin, the OCE is a structured interview exam. It is not an OSCE, and so you will not be asked to demonstrate any skills, and there are no standardized patients. The OCE is broken into 2 cases, and you have a maximum of 3 hours to complete the entire exam. There are no scheduled breaks. Each case is estimated to take about 90 minutes or an hour and a half to complete, but you will not be stopped at the 90-minute mark to move to case 2. You will be examined by 2 examiners, and both will be marking your performance and helping to move you through the exam. Although examiners are trained on the entire exam form, they will take turns leading the exam. One examiner will lead the first case, and the other examiner will lead the second. This exam progresses in a linear format, meaning you will start with the first case and move sequentially through the material until you get to the end of the exam. The exam must be completed in the order presented. Once you have answered and moved on from a particular question, you cannot navigate back to it. It is considered complete. All case information is presented in a written and audio format. The audio file and the written document contain the same information. So what is a structured interview? A structured interview exam is a mix of open-ended and closed-ended questions. During your exam, you will be presented with information in the form of long cases with additional information provided throughout. Your examiner will ask you questions that will require you to apply your knowledge to the context of the situation to assess your critical thinking, reasoning, and clinical judgment. Examiners are listening for you to clearly articulate your reasoning for each part of the answer you provide. Before we look more closely at the cases, let's quickly revisit the blueprint. The blueprint is the most important piece of information you will need to review because it defines the scope of the exam and the format. If a subject area is not on the blueprint, it will not be covered on the OCE. The blueprint itself is a rather large document that's available on the website under the section titled Preparing for the OCE. I'm going to walk you through the entire document. I would recommend opening the blueprint now and following along or making notes. One thing I want to highlight before moving forward is that the exam will reflect the necessary skills and abilities or the level of competency of an entry-level physiotherapist's scope of practice. The purpose of the exam is not to trick or confuse. It is to give you an opportunity to display your knowledge in the field of physiotherapy. The first part of the blueprint I want to draw your attention to is on page 4, table 1, if you're following along, and labeled as the case context. As an entry to practice physiotherapist, you will have had experience managing patients in various practice settings who are of a variety of ages and who present with health issues related to different body systems with single or multiple comorbidities. This excerpt from the blueprint outlines all of the possible practice settings, systems, and age groups which could be represented in the exam. Further information on the conditions by body system is outlined in the blueprint in Table 2, titled Conditions by Body System. These should all be areas that you would have touched on in your university studies, as well as through various practicums and clinical placements. One point to highlight is that every candidate will receive one case related to the musculoskeletal system in the context of a rehabilitation facility or a private practice facility. The next portion of the blueprint I want to break down are the domains of practice or domains of competency. The OCE blueprint was based off parts of the National Physiotherapy Advisory Group's Competencies Profile for Physiotherapists in Canada, 2017, and was validated by a series of focus groups and surveys that were targeted at resident PTs and registered PTs throughout the spring of 2021. As a result of these focus groups, some areas of the competencies profile for physiotherapists in Canada were determined to not be appropriate in the assessment of entry to practice physiotherapists. For example, you can see that we have 6 primary domains of competency in the blueprint. However, domain 5 is missing, as it was determined to not be appropriate for assessment in the OCE. You will continue to see throughout the blueprint that some secondary domain markers were also skipped. So, how can you use the blueprint to study? Well, first, it will help you organize your time to ensure you're studying efficiently. This table, presented on page 6 as Table 3, shows how the exam is weighted, meaning how many questions in each area you will be asked. This does not mean that you shouldn't study areas weighted lower, as all areas are important. It just means more time should be spent covering information in higher weighted areas. Before we get to specific examples, let's make sure that the organization of the blueprint domains is clear. The blueprint is organized from general to specific. Think of it like a series of boxes. The primary domain is the largest box and the broadest category. Inside that box is a slightly smaller box, the secondary domain, which is a specific category of knowledge within that broad primary domain. Inside that particular secondary domain, we then have an even smaller box, the competencies. And they are the behaviors which demonstrate competency. These are usually action-oriented items. Now that we understand how to approach this document, let's dive into it starting with Domain 1, Physiotherapy Expertise. You can follow along on your own copy of the blueprint, starting from page 7. Let's look at Primary Domain 1, Physiotherapy Expertise. You will see there are a series of secondary domains that align with it, shown here as 1.1 and 1.2. And attached to each secondary domain is a list of associated performance indicators, entry-level milestones, or behaviors that a competent physiotherapist should demonstrate. These, listed here as 1.1.1, 1.1.2, 1.1.3, and 1.1.6 are the behaviors that you want to demonstrate or communicate to your examiner during your exam. Make sure you understand the key words listed. You will also see that, as we mentioned earlier, this is an example of omitted competencies, where 1.1.4 and 1.1.5 were not found to be appropriate to measure on the OCE. As we mentioned, every candidate will receive one case related to musculoskeletal system in the context of a rehabilitation facility or a private practice facility. Case 1 will be on assessment, while case 2 will be on treatment. The assessment case will focus on skills related to accepting a patient, informed consent, completing a clinical exam and generating a clinical impression based on assessment findings, and making appropriate recommendations. The treatment case will focus on skills related to the development of a treatment plan, goal setting, collaboration, consultation and referrals, monitoring of a patient, and discharge planning or transition planning. Additional case information, 2 to 3 sentences, will be presented multiple times throughout both cases of the exam. The details provided in this additional information are designed for candidates to demonstrate their critical thinking and judgment in aspects of the PT role, such as communication, ethics, supervision of PTAs, and confidentiality. The list of topics assessed is provided on page 7 of the exam blueprint document to help you focus your studying. Most of these areas are covered by the college's standards and college-curated resources, such as our videos. I will be using the sample case posted on the website for the next few slides. If you don't already have it available, it might be helpful to access it now. As seen in this sample, the case information provided to you will be similar to what you would receive in a referral and information collected through initial patient paperwork. Case information will indicate the practice setting, system impacted or clues to the system impacted, the patient age group, and relevant contextual factors. All of this information will factor into how you form your clinical impression and will impact your decision making. Your examiners will ask you questions, and you should respond with the specific case in mind. When reading the case information, you should make organized notes of key points. For example, highlighted in yellow is the practice setting. The setting will inform your assessment or treatment of a patient. Highlighted in blue is the system-related information. Green is the age group, and pink are the contextual factors. This is one way you may want to start organizing the information. If any of these pieces of information were changed, your approach to patient care would likely also change. For example, your methodology for assessment will be impacted by the overall condition of the patient. You might need to make different choices. Or your process will likely change if you're working with a child versus an adult. In the exam, you will be presented with both a written copy as well as an audio recording of the case information, which will remain available to you throughout the case. You can choose to read or listen to the case information, or do both. Both pieces of media will contain the same details. At the end of the case, you will see the core question. You'll have 5 minutes to review the case information and the first core question. During this time, you can take notes within the exam delivery platform or on a small handheld whiteboard. Once the 5-minute reading time is complete, the examiners will prompt you by stating the core question. You can let your examiner know if you're ready before the 5 minutes are up, or you can take an additional moment to complete your notes, but remain mindful of the time. Core questions are broad, fairly open-ended questions that are prefaced by an orientation statement to help you focus your answer. All candidates will be asked the same core questions, and these questions are standardized. The orientation statement in this example is highlighted in yellow and is followed by the core question. Each case will have between 8 and 10 core questions associated with it that will focus on different topics. Each core question that you are presented should take you about 4 to 8 minutes to complete. Make sure your answer is specifically related to the case presented and addresses the question you have been asked. While working on a case, your examiner will provide you with additional case information throughout. This may include new factors or situations, as well as test results or changes in the client's condition. When you are provided with additional information, you will receive 3 minutes to review and make notes before being asked the next core question. In case 1, you will be provided with assessment data in addition to the additional case information. For the assessment data, you will receive 5 minutes to review and take notes. Depending on the fulsomeness and specificity of your answer to the stated core question, you may be asked a probing question. Examiners are provided with scripted probing questions, which are only delivered verbally and are linked to specific performance indicators on the blueprint. Probing questions provide a standardized way for examiners to assess your knowledge and to probe for further information or detail. You do not lose marks for being asked probing questions. If you need to take a moment to review the case information, consult your notes, or think before providing an answer, you can do so. Just remain mindful of the time. Your examiners will also work to move you along. Listed, you will see a few examples of probing questions. Examiners have a menu of possible probing questions that they could ask, but they may not ask all of them, especially if you have already provided an appropriate answer while addressing the core question. Now that we know how the blueprint works, how do we then best utilize it to study? Let's use case 1 assessment as an example. As I mentioned, case 1 will always deal with assessment. So you can review the blueprint to find performance indicators that may be assessed during this part of the exam. According to the blueprint, it would be reasonable to assume that for case 1 assessment, your examiner will likely ask questions related to the domain of physiotherapy expertise, specifically about secondary domain 1.3, conduct a patient assessment. You can see there are a series of performance indicators or competencies associated with this part of the blueprint. These are the key behaviors you should be able to demonstrate based on the condition and patient specifics presented. Your examiner will ask you questions to judge your ability to perform these behaviors when working with a client or to understand your reasoning when creating a plan of action. A couple of great study resources are the Clinical Reasoning Framework activity and the Chart Stimulated Recall worksheet that you can find on the college website. Use these resources to apply your knowledge and then practice stating your answers out loud. In addition to reflecting on your current or past client situations, you may also want to create new scenarios. Candidates find working in study groups to practice verbally working through scenarios extremely helpful. You can also cite your textbooks or university materials to find case studies. Remember, the OCE is a verbal exam. It is strongly recommended that you practice verbally delivering your answers. It is important that you're comfortable thinking out loud and communicating how you would approach different situations or manage patients in a concise and organized manner. So, with all this information, how should you go about answering the core questions? First off, make sure you have read the case and are citing the specifics within the case. You may want to reflect on your notes before answering a core question. Then, provide your answers in order of events, so step by step. Examiners are looking for answers that are concise, logical, organized, and appropriate for the context of the case. It's important that you avoid saying what you would generally do and instead anchor your answers in the case specifics. Examiners will not be asking you simple yes or no questions. Instead, they will be seeking to assess your clinical judgment, critical thinking, and reasoning skills. The core questions are designed to be open-ended to elicit detailed and complete responses within a specific topic area. Every answer you provide should explicitly include your reasoning. This means explaining why you are doing something and how the context of the case influences your decision. Your examiners can only mark what you tell them. They will not assume anything. Now, let's look at the posted case example again. Take a moment if you do not have the case from the website open. When you encounter a new patient, like Sam in our sample case, you probably first look at their chart or referral. As mentioned, the case information will include all initial information you need to start. Here are some things you may want to consider when forming your answer to your examiners. The core question for this sample case is asking you to describe the steps you would take to conduct the assessment. Based on Sam's case, do you need more information before starting your assessment? If so, what? How will you gather this information? Why is this information important? How could it impact Sam's care? Again, look at how the behavioral indicators or competencies on the blueprint relate to how you can go about answering the question. How do they practically apply to the different parts of a physiotherapist's role? Now that you're ready to complete your assessment, what will your assessment include and why? Using the case of Sam, how would you demonstrate knowledge of these competency areas? What actions are you going to take? You can carry this mindset forward as you prepare and practice with textbook cases or study group scenarios. As we saw earlier, additional case information will be presented at multiple times throughout both cases. And the questions presented along with this additional information will cover domains 2, 3, 4, and 7. If we look at our blueprint again, and specifically at primary domain 2, communication, and the secondary domain 2.3, adapt communication approach to context, we see a series of action-oriented competency behaviors. Given these performance indicators, you will be asked questions based on a specific scenario. How will you demonstrate these behaviors to the examiner? You will want to describe to them how you adjust your communication strategy based on the setting, the level of understanding of the recipient, the intended audience, And know, what does empathetic and respectful communication look like? Depending on the scenario presented, you will need to tailor your communication strategy to the specific needs of the client and ensure it is appropriate for the situation too. You will also need to clearly state your reasoning for why you are doing every action you describe. Closing off with a note about your examiner interactions, you will be examined by two examiners, and your examiners are tasked to provide a standardized approach, meaning at times what they say may sound scripted, and that's because it is. And they are trained to adhere to a script. Examiners are instructed to maintain a neutral demeanor to support a standardized experience. This means that your examiners will be polite and respectful, but may not be especially emotive. Examiners will not provide you with any feedback regarding your performance during your interaction. Although it may feel comfortable for someone to make jokes, small talk, or smile a lot in a casual setting, examiners are discouraged from these types of behaviors as they could be easily misinterpreted in some circumstances. Of course, this does not mean you can't communicate with your examiners. Your examiners are also there to support you. Let them know if you would like to have a question repeated. If you don't understand a question, your examiners may be able to reword the question, but keep in mind they cannot provide definitions to key terms. Make sure you're familiar with all the language used within the blueprint. We ask that you also tell your examiners if you need to take a moment to think before answering a question. This way, your examiners are not worried that you froze on the online platform. At times, your examiners may interrupt you. This can be for a variety of reasons. They may interrupt you if your answer is quite robust and has met what they need for their marking. Keep in mind, this is a competency-based exam, and we're not looking for excellence. And to help you manage your time, your examiner may thank you and move you along. Your examiner may also interrupt you if your answer is not quite specific to the question or scenario provided. Again, this is to ensure that you're not spending time on providing information that your examiner is not looking for, and so you can get through all the material. Lastly, please know that your examiners have undergone and continue to complete extensive training to ensure a standardized, fair, and valid exam experience for each candidate. So now that you understand the format of the exam and the blueprint, how should you go ahead studying? Practice verbalizing your answers. This could look like narrating or focusing on communication with your clients, maybe reviewing client cases from textbooks or working with colleagues and practicing stating your answers. Do not go into this exam having never practiced saying anything out loud. You can study with your peers through case discussions. Practice presenting a case and outlining your logic using college and other empirical references. The blueprint can also help you structure these discussions. If you don't have access to a group of peers, you can also self-study. Practice answering questions in front of a mirror or record yourself so that you can review to reflect on your answers. Reflective practice in general is a big one. So that can look like journaling or talking through cases with another colleague. And that brings us to our last point, which is to read the standards, the essential competencies, and the blueprint, and work to understand them. Reflect on how you integrate the standards into your everyday practice. And with that, that is the last of the information I have to provide today. Everything we've discussed as far as videos, resources, information can all be found on the collegept.org website. If you have any additional questions, please don't hesitate to reach out to the exams team at exam@collegept.org. Thank you so much and best of luck.